Fibromyalgia affects over 12 million Americans. Patients, they might experience horrible pain and a lot of frustration.
Fibromyalgia is one of the most difficult pain syndromes to treat. There's no cure, but something called NUCCA care has provided relief. We've heard that firsthand right here on the show.
That's right. Dr. Drummond returns from Spinal Balance Health Center. Good morning, doctor.
It's nice to have you here.
Good morning. Good to be here.
Fibromyalgia.
Yes.
It's common, but a lot of people just, they probably don't even know they have it, right?
No, it's a really difficult problem to diagnose. And there are a lot of different symptoms that go along with it, and there's multiple causes. So what most people will experience is a lot of pain. There's one of the parts of the diagnosis is of the 21 common pain areas, they have 17 of them that they'll say ouch when you poke on them. And they have a decreased tolerance for pain, so small pressures, like they might get a hug from somebody and they light up with pain. It leads into other problems like digestive issues, difficulty sleeping, headaches. There's something called like a fibro fog, where people just don't process information. It kind of almost feels like they're hungover. And it doesn't seem to respond very well to medication, which is one of the reasons that it takes so long for people to find success with some kind of treatment, because they just skip around. Opioids don't work, pain medications don't work.
Well, a lot of people don't want to take those anyway.
That's
they just
true.
want to feel better without like having to deal with those addiction concerns and some of that other stuff.
Yeah, what'll happen with most people is they'll go in with a symptom to their doctor and they'll try a medication for their symptom, and then they'll leave and the symptom won't go away and the medication won't work, and then they'll go back to the doctor saying it didn't work, and here I've got 2 or 3 more symptoms, and it just takes
And for years, people are caught up in that.
Yeah, and you're a doctor that deals with upper cervical issues.
Yes.
So how does that, adjusting issues up here affect fibromyalgia?
It's agreed by most healthcare professionals that deal with fibromyalgia that this is a nervous system problem. Multiple problems maybe within the nervous system, but it is the nervous system. And what we do as upper cervical practitioners, we found a misalignment at the top of the neck that will cause widespread issues throughout the nervous system. So if you look at the left-hand picture, there's a head and neck that are straight up and down. The top bone of the neck is horizontal. That's the normal orthogonal position. On the right-hand side is what happens to people that have been through accidents and injuries. So when that bone is misaligned, it doesn't damage the nerves at the top of the neck, but it affects the nerve flow through the top of the neck. And then that leads into different symptoms. So when we correct that, we see all kinds of amazing symptomatic changes. So there's another video we have that actually shows how these nerve impulses flow through the body. They start at the brain, they travel down through the spinal cord out to the body, and then back up through the spinal cord to the brain. And it's this communication that allows the body to function properly. But if that bone at the top of the neck is out of place, it will cause widespread symptoms that are they're hard to trace back to the upper cervical area. So a medical doctor will try and treat it symptomatically. But if you actually correct it, you can get the body healing.
The key word to me there was widespread, because I'm connecting it back to what you said just a moment ago about those 17 points and defining fibromyalgia. And so that your whole body, that's why you're experiencing that pain all over the place, or the sensitivity everywhere. When patients come in, do they already know they have fibromyalgia, or is that something that a diagnosis might come after you've had a chance to start to look at some of these other things and add it all up?
Yeah, I have a range of them. I don't know if you remember, there's a guest named Joyce that came on. She was a nurse that had it for 30 years. And she went through the whole medical model until finally she'd given up on everything, and she knew it was fibromyalgia, and we fixed her. And it was like a week later she was out of pain. And then I have other people that have had it but don't have the diagnosis. And some people have a portion of the symptoms but not others. So there's no one patient that comes into my office. They just know they're not functioning right. And I believe the body should function properly. You shouldn't have all these different areas that are not doing what they're supposed to and then believe that they're all independent problems. There are usually these central core issues that then spread out and turn into the symptomology that we call fibromyalgia.
Yeah, well, you talk about that. It's the main channel right there at the neck, the main gateway that allows that nervous system to work. But at some point, sometimes it's just an injury, right?
Yes.
That maybe lasts for years and years, and sometimes it's, I think, didn't you say one time it can go back to childbirth?
Yeah, if you wanted to go to the first accident that could possibly cause a misalignment, it would be childbirth. Either when a baby's pulled out with forceps or a vacuum or hands, or C-sections will do it. Childhood accidents like falling out of trees, and bike accidents. As adults, it's car accidents that seem to be really a common one, especially now with everybody texting and running into the back end of other people's cars. And fibromyalgia will a lot of times start after one of those accidents or injuries. People will go back like, oh, this started after that accident.
Sure.
Yeah.
How do you know if you're a candidate for care?
It's
I'm thinking about everybody watching now.
I know, and You just need to come in and have an upper cervical professional like me, look at the posture and determine if you have the indicators of an upper cervical misalignment. And so many people have gone through the process and given up. I would encourage people that are listening not to do that. Just have us look at you and take that one last step that you said you weren't going to take.
Well, you think you would exhaust everything you could before you give up on something like that.
A lot of people don't know about this because there's so few doctors that do it, so they don't even know there's that next step.
When you talk about the actual procedure to fix the misalignment, it's fairly gentle.
Yeah, real gentle. People that are in a lot of pain are really hesitant to go do something they think is going to hurt. And sometimes chiropractic is associated with more of a thrusting kind of a maneuver that might be painful in their minds.
A cracking and a popping.
Yeah, and really this isn't that. It's so gentle. Most people wonder if I'm even doing anything as I'm adjusting them and not thinking that it hurt for sure.
Yeah,
It's
you're
very
not getting popped.
No,
when you go to see Dr.
Yeah.
Drummond. It's just it really is that one tiny bone at the top of the neck, and just evaluating it, which brings to the special offer, because this is really where it starts.
Yeah.
When people come in, you take these. It's kind of like trigonometry, what you do, where you're looking at these specialty X-rays, the exam. He brings this bundle. He can't do it for everybody, but he is generous to give it to 15 of you watching now. If you want to call his office, mention the show, and then you can make that appointment and just for $50, see if you are, in fact, a candidate. He's a local doctor. We'd like that as a local show. You can learn more about the Spinal Balance Health Center online at spinalbalancehc.com, but that's the number to call to take advantage of that special offer if you'd like to.
Doctor, thanks for your time this morning.
Hey, thank you.
Dr.
It's great
Drummond.
to be here.
Thank you.